So this part of the Good Medical Practice document talks about yourself, and it's something that's very common to doctors throughout the world, really, regardless of which country you're in. But certainly there's an emphasis in the Good Medical Practice document about this. So you must take heed and you must really value this part of the advice I'm about to give you. And that is that look after yourself, all right? Before you can give good care to patients, to the community, you need to be able to look after yourself. You need to be able to take good care of yourself, all right? Because bad doctors make bad healers or bad practitioners. If you're not well, you won't be well enough to deliver good care. If you're not delivering good care, then really you might end up harming the patients. You might end up harming the community. And that's somewhere where we do not want to end up. So the advice is, first of all, make sure you look after yourself. Lead a healthy life, eat well, look after yourself, and always maintain a good work-life balance. Importantly, make sure you have your own doctor, somebody who looks after you, whether it's your GP or, depending on which country you're in. But certainly in Australia, UK, or Canada, have your own GP, have your own primary care physician to look after you. They will provide a more objective understanding of your health. Now, when you're subjective about your health or whatever matter, then emotions come into play, and you don't always have the balanced view on things as you might do when you look after other patients. So that's why it's important to have someone else to look after you. It's important that you seek help. All right, when things aren't going right, you seek help. Try not to self-prescribe. Try not to self-manage. Get that objective view on your problem. You'll be surprised how often somebody will pick up on something that you yourself haven't picked up on before. An area that we are very bad at in self-managing is psychological problems. That includes identifying stress. People work too hard, long hours, things are busy at work, and we kind of just coast along. Quite often we don't recognize the signs, or we don't want to see the signs of stress, of burnout, and then it develops into anxiety, into depression, and so on and such forth. People resort to behaviors like drinking more, taking drugs, and so forth. Relationships break down, family stresses, marital stresses, all of these things come in, and we're not very good at dealing with them. Quite often it helps to have that third person to look after us, to keep an eye on us, and to be able to point out where we need to improve. That's why you must have someone else looking after you. Do not fall into this trap of self-diagnosing, self-prescribing, and so forth. It's dangerous and it can cause problems. Of course, as professionals, as I alluded to before, we are working in a highly charged environment. It's very busy, there's a lot going on, lots of positives, but at the same time, because of the pressures, because of the frequency of interaction and work we do, it's not uncommon for doctors, for dentists, for healthcare professionals to suffer from stress and burnout. Again, by talking to somebody, they'll be able to help us identify and therefore come up with remedies, come up with solutions in avoiding stress and burnout. The other things, for example, in terms of long-term health, important to be immunized. It's important that we look after ourselves in that sense, so that in terms of health prevention, we're in a strong position at all times. So these are a few tips and a few areas that one needs to consider of in terms of looking after oneself.